blow me down. What's up, guys? Welcome back to our nursing series.
Nursing in a nutshell.
Part 3.
It's back. What are we going to be talking about today?
Today we are going to be talking about terms 3 and 4. So basically, term 3 and 4, you are almost at the end. You're getting there. You're almost done. We want to give some tips and advice about clinicals, what you should focus on, like what you're actually going to be using when you work. And then we want to talk about also like what everyone gets towards the end, and it's okay, which is senioritis. Everyone gets it. Yeah. At the end, you're kind of like, ugh, like I don't want to keep studying. Like I'm almost done. You feel you kind of slow down. Maybe your grades start to go a little bit down. It happens to all of us. So we want to talk about that too, and maybe more tips on how to avoid that, and if you feel that, how to get over it, because it is hard getting over that feeling.
And we are in scrubs only because this video or these topics that we're talking about, we're almost at the stage of you guys getting your own scrubs. Yeah. So we felt like it was necessary. Let's put on some scrubs for this one.
And this scrub is basically me. I love colorful scrubs. I don't like to match my scrubs. I feel like it's too much. So if I have a gray bottom, so I have like a black top or a pink one or a print, you know?
But also it's your preference.
Yeah, it's your preference.
Whatever you guys want to do.
But we just want to show a little bit of like my prints are just super crazy.
Our own flavor. This doesn't represent me. This is just what I wore. It's just all black. But yes.
Because there's not a lot of,
still not a lot of choices.
Guys.
But
anyways.
Let's just get right into it.
Yeah.
Where are we at? Term 3. What's going on in term 3? Some of you guys might be in what? Medsurg?
Medsurg.
Actually, a lot of medsurg. What are we at? Advanced medsurg? Right? It's not playtime anymore.
Psych.
Yeah. What is it? It's deeper in, huh?
Yeah, you get more deeper in all your systems and everything.
Those nasty like diseases that you gotta remember.
The eyes, stuff like that.
But per chapter, there's like 30 diseases, but you only get quizzed for like 3 of them. But you got to remember all of them.
Yeah.
And
it's hard. It's term 3 and 4 are super hard. Super hard.
And then term 3, what, you guys are probably picking up the pace on like clinicals and actually getting into the
medicine,
the
medpass.
Well, let's talk about that. Let's talk about
medpass.
Experience and also tips on how to get better during clinicals with medpass.
Right, and what you should really like get down into and really pay attention, because you're going to be using it when you work. So medpass, you're going to be a charge nurse. You're going to be in charge of giving medications to your patients. So when your teacher starts to like quiz you, I know it's really, you have a lot of anxiety when your teacher's right there and they ask you like a bunch of questions, and then what's the side effect, what you should know, why is it like this. Like I gave me a lot of anxiety. Like I would always start to like kind of shake a little bit, because you get scared and then intimidated, like damn, like I don't know the question, or what if I'm not even a good nurse, So it's okay. A lot of the times when you work and you pass your medications, a lot of the times on like your MAR, where all the medications are listed, they kind of have like the side effects there, or you just kind of like you get used to the medications. You're gonna see them all the time, so they're gonna get a lot easier.
So don't get frustrated.
Yeah, don't get frustrated.
But another tip when you're in clinicals and your teachers breathing down your neck about it, whenever you're in doubt, just talk your way out. Just do the medicine and just walk away. Just get out of there. Do your medication pass, and then
just try your best.
Look it up later.
But it is really important to know what you're giving, at least like the basics, like for hypertension medications. You're going to be giving those a lot. So it's always important just to know like the little basics around it. Just know what you're giving.
I mean, just when you guys are starting out, just know the parameters, When you guys are taking your patients and your blood pressures and heart rate and doing it the right way.
We try to do it the right way.
Doing your watch and checking for
an hour later, one
respirations.
patient done.
Yeah, you know. And then, you know, in little cuppies, here's one medication. You label it, you know. Here's another one. Get the water. All these kind of things.
But those are good practices because
good practices.
When you're in the work field, you're going to get those patients that want it the right way. So they're going to teach you shortcuts, but always remember the right way. Never forget it. But yeah, you know, just try your best in medicine pass. You're going to be using it. You're going to be doing it a lot when you become a nurse. So.
And also, you guys are probably in class learning injections.
Oh yeah, injections. Like
I remember when we were in class, I did like, what was it like? For IM, it was like an orange. We were stabbing oranges. Yeah.
Oh yeah.
We were stabbing oranges.
We
I stabbed the sausage.
Or the hot dog weenies.
Yeah, the weenie, and then that was for the intradermal. Get the little right there. Get the little bubble in there. And then I remember when we did one of the things to get past term 3 for us, we had to do a return demonstration. So we did like medpass, a medicine. We had a patient, we went inside and actually had a cart to look through. And then when we did intradermal, there was like this little piece of skin or something. Those little squishy things.
Yeah.
So you have to actually do your needle, get the liquid, and actually just push it in like an actual real injection. And then if you get through all that, they'd be like, okay, you passed, you know.
Oh, okay.
So they might be going through that too.
Maybe. Yeah, my school had some other things. We had like the cart, like if you were by yourself, we had the cart ready. Yeah. So they would show us like in each cart what each medication would be at and what it was for. And then we had dummies in my school. Yeah. We had like baby dummies, and then we had like adult dummies that we could practice on. So that was pretty cool. And the dummies were actually like, how did I describe? Like, they would actually be like real people. You know, they would like complain. Like they were actually interactive, which was really crazy.
Well, look, do you see the difference in?
Yeah, my school was. Yeah, we had like a lot of things that could help us.
How was that a dump then compared to your place?
That's why get a good school.
Yeah, don't cheap out. I went to the school because it was way cheaper than anybody else, but now I realized there's a reason why it was so cheap. You know?
Yeah. But anyways,
that's another video. Forget about that. You know, we'll talk about all those things later. But yeah.
Yeah, so just make sure, you know, you do your best during MedPass. And then another thing you might be doing more in clinicals would be you know, inserting Foleys. Maybe. Don't be scared, by the way, of putting yourself out there. Like, if you haven't experienced something in your list that you need to do, get out there and find it.
Yeah, because there might be things that actually happen on the clinicals, like just something random that day. Like, oh, they're giving out a bunch of IM injections, or somebody's removing staples, or all these different things that might happen when you get there. And your chance is to just be going forward and getting in there. Looking and seeing if you were able to do something. Right. You know, because you're not going to get those experiences all the way until
because you will use them when you're by yourself. You know? Yeah. And you want to at least see it. Maybe you're not going to do it, but at least seeing how it's done can also help you.
Oh, and they're probably going with treatment nurses.
Yeah, with treatment nurses.
Treatment nurse, it's important. There's a lot of, especially if you guys choose later on, we'll address it in a different video, but
the different type of jobs you might.
Yeah, and then if you do, especially night shift, there's no treatment nurse. Yeah. There's mainly treatment nurses in the morning that take care of everything. But, you know, if the treatments get soiled during the night, you as a nurse have to change it. So when you get the chance of getting assigned to a treatment nurse too, do not avoid it. Get in there, get your hands dirty, say, let me try it, do it the right way, and figure out what different things do, and that will really kind of help you for later, you know?
Yeah, because depending where you go, they can have a treatment nurse, but then what if that treatment nurse is super stacked up with work, or they call off and they don't have another replacement, and you have to be the treatment nurse for that day. So just, you know, don't be lazy. Don't think like, oh, I'm just gonna kick back and not really do much. Like, no, you need to follow the treatment nurse. You know, get yourself exposed to the different things that are going on, because it will really benefit you.
Well, and there might be also during the time doing insulin checks, getting used to
checks too,
administering insulin. You know, That's another anxiety thing, because you're actually
you're poking them.
Yeah, and you're going into the person's room, asking them to check it. So, any tips on that one right there?
On that one,
because a lot of people struggle in the beginning. They're tense with getting it open, like the actual the syringe, grabbing the air, remembering to put the alcohol on the top, poking it, and then also the thing that would trouble a lot of people is actually drawing out the liquid, the
that's
insulin.
true, like measuring.
And there's air bubbles, measurements that you guys gotta, but I think over time,
just practice.
Just practice.
Makes
perfect. Any time you get it, don't avoid it. Right. If you're able to do it once every day that you're at clinicals, attack it, because you're only gonna get better, and it's better to have your clinical instructor there for you when you're struggling a little bit, or to be like, can you get the air bubble out, or can you help me with what's a better technique for this? Right. Because you always learn little things that you might want to do.
You never know everything.
Yeah.
You never do. So also, depending on which clinical site you go to is also beneficial. For example, I went to a subacute clinical center. So they helped me. All the patients were vets. So I was able to learn how to suction, but for that time, my clinical instructor was very lenient. Like, she wouldn't go up to the charge nurses and be like, could my students do this, or could my students see this? Like, she was kind of like outside on her phone and not really like teaching us. Yeah. So at that point, you're the one who has to kind of like interact with the workers and be like, can I please see it? And they'll let you most of the time. If you like talk to them and explain the situation, like, they'll let you.
Yeah. If you have one of those teachers, don't be with the teacher and be like, all right, let me go on my phone too.
Like, let me go on break.
Because you want those moments to learn.
Right.
You can have moments to be like, okay, let's chill for a couple hours here and there, but when it's go time and you're able to, you should just try to do something.
Yeah, that was my term 3, I think. Yeah, it was 3 where the teacher was kind of like, it was a point where we were having different teachers every single day because we were short on teachers. So at that point, all the students had to basically teach themselves and find people who are able to teach them. Yeah. And that's what happened to me. One of the workers there was able to help me how to do G-tube medications, how to handle vent patients and suction them, and that like stayed with me forever. Like, even for the job we're currently in right now, it's a subacute hospital, and that helped me. I just remembered. Yeah.
And then
G-tube meds too, they're really important. You're gonna find G-tubes everywhere you go.
And that's probably gonna be the same idea as those of you who are in term 4. You're gonna probably have less teachers. You're probably gonna have to self-teach, but that's when what we mentioned, senioritis hits. That feeling like, you know what, I'm ready to go. Yeah, like, I don't want to do this. You disappear in your car for hours. You come back and you just say, well, I was helping somebody out, but where were you? You were sleeping on your phone somewhere. So you get those moments of like, I'm not gonna do any work. That's literally how you carry yourself all the way through term 4. But
you just have to keep pushing. You're almost finished. You don't want to mess up, and then your grades start to get low, and here comes a test that you just didn't do good at, and that's it.
Yeah, because term 4,
there's tests every time, every day.
For us, we had, what was it? Man, it's been so long, I don't remember. But I remember peds and maternity. Both those together were 10 days, 5 and 5. So we had to learn like 7-8 chapters every day, take a quiz, take a test, learn chapters, take a blah, 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 and then a final, and then next time you go. So it's fast paced.
Yeah.
It's harder. Yeah. Oh.
No, keep going.
No, I was just saying it's harder than term 3 because of the amount of information you have to absorb and to be able to like remember things.
Term 4, you're basically finishing.
Yeah.
So every test is being thrown at you, and you're finishing. You're just getting ready to take your HESI, your NCLEX, like, you're finishing.
Yeah, you might be starting review, maybe. Yeah. Maybe.
Like some schools do offer review sessions, or some teachers stay after and they offer help. Yeah. So really take advantage of those teachers. For me, because I think I mentioned on the previous video that my school has an ATI system. We started to get it on term 3 and 4. So in term 4, we were taking chapter test, then ATI test, and then we had to take another test before we were able to pass the other course. So we were taking like tests every single course and every single time on top of like handwritten tests. So it was crazy. It was a crazy time. So if you slack off
just a little bit,
your grades will slack off, and before you realize, you can't take your exit exam.
Yeah.
So you don't want to be that. You
want to have time for play. Yeah.
Right.
You want to have time for play.
Like, you're so close to getting your license, and you don't want to mess with that.
Yeah.
So you just want to keep on studying, keep on reading, just keep on like doing anything you can.
Yeah, because next thing you know,
to that point.
Once you start filling out that paperwork, the exit exam comes, and then your English, you gotta study for that.
Yeah.
That's a future video. But
because that's
that is a whole nother topic. But you gotta stay focused to what your goal is, and not get caught up that it's term 4.
Right.
I'm at the finish line. Let's go on cruise control.
Right.
Yeah.
Make study groups, study guides. Go to each other's houses and study. Like, make it fun, interactive. Yep. That's what's gonna get you by. Because honestly, having your friends there and working together, it's gonna help you. You don't want to handle it alone because it's not possible. The amount of stress, the amount of workload that you have to vent. You have to just interact with people, because those are the only people you possibly might be interacting throughout your whole school time.
Yeah.
So just enjoy them, use them.
Enjoy the moment.
Enjoy the moment. Enjoy the help, because you're gonna look back. You're gonna be like, damn, like it's gonna go by so fast. So just enjoy those moments. Yeah.
That's pretty good. That's pretty good right there. That was well said. For those of you maybe experiencing senioritis right now, don't get too crazy and have fun all the time. You got to button down.
Right.
Because that term 4 is going to fly by.
Yeah.
And next thing you know, it's go time.
It's go time.
You need to score, 1100 on your exit exam, You got to get that. But
so, in summary,
to close out,
clinicals, take advantage of them. Make sure you expose yourself to anything possible, because you have to finalize your like just how you do things, because you will be examined by your instructor about those different like Foley catheters, medication pads. They're gonna see if you're able to do that, so you want to be prepared for that. Next would be senioritis. Try not to get it, and if you get it, get out of it.
Get out of it as soon as possible.
Get out of it, because your license, man, like, it's so important, and you're almost there. So just keep fighting for it. Imagine you're spending so much money to just like drop out or not be able to pass.
But then you got to pay again to retake the course.
Yeah.
And that's another waiting period, and then more money coming out. So don't get in all that. Just try to get it done first run.
Try your best. And then have fun. This is almost the last time you might be able to be with your classmates, because they have different jobs.
You guys will realize you kind of miss school.
Yeah.
And you miss seeing whatever group of friends you had maybe at that time. Because everyone kind of splits off.
Yeah. Different lives, different plans. So enjoy them. Study groups with them. Just have fun at the end as best as you can.
Exactly. But that's gonna do it for this video. Thank you guys so much for watching. We hope you guys enjoyed it. Maybe you guys take something to heart. Maybe some of our advice, our suggestions kind of helped you guys through. Hopefully even the ones from the first part and the second part, you guys are able to take in our considerations, and it's actually helped somebody out.
Yeah.
But that's gonna do it. Thank you guys so much for watching. This is Life with L&R. Nursing.